What if healthcare waste is not coming from bad medicine, but from delayed decisions? Every extra handoff, prior authorization, and disconnected workflow can slow patients from getting the right treatment. Today, Dr. 𝐒𝐿𝐼 𝐒𝐒𝐡, physician executive and VP of product at Avalon Healthcare Solutions, breaks down how diagnostics, payer partnerships, and smarter workflow design are helping speed care, reduce waste, and make precision medicine actually actionable at scale. Healthcare entrepreneurs, are you ready to rewrite the rules for your business so you can have more time off, a great team, and more income while creating a positive social impact? Then you are in the right place. Welcome to The Provider's Edge. I'm your host, Sabrina Rumbach. I'm a provider, an international peak performance keynote speaker, and a best-selling author. Let's open the gateway to profitability for you today. My guests and I help healthcare entrepreneurs and startup founders like you break through barriers so you can control your business, control your life, and control your future. This is your defining moment to be a disruptor in healthcare. Hi everyone, we are back at Health. It's always exciting to be in the room full of thousands of people who are caring about innovation, care about pushing the boundaries of what we can do in healthcare. And today we have Dr. 𝐒𝐿𝐼 𝐒𝐒𝐡 here with us from Avalon. So 𝐒𝐿𝐼, what truly brought you here this time? Every year is a little bit different. We're popping up with new innovation, new pavilions. What's exciting for you this year?
So we know every day there's 10 new genetic tests that get approved. And the number of tests, whether they're routine, genetic, precision medicine, is just skyrocketing. And what are clinicians to do, right? How are they ever going to keep up with all of this information with guidelines that change every 3 months? So at Avalon, we're a lab benefits management and insights company, and we're helping to kind of help providers, payers make sense of all of that in a very evidence-based, data-driven way.
Awesome. And I think for us in healthcare, mostly people is like, show me your data, right? And then I think we're so entrained into how do we present data, understand data. You can have all the innovation out there, solving a big problem. Is that actually getting the engagement that we want, right? Because we can build all these technology solutions, but if people are not using it, right? If we're not using it, clinician, patients not using it, then what's the point of throwing millions of dollars in it, right? So with you guys, this is genetic testing and then focusing on this data part, how do you see the adoption and usability come to play?
The data, you're right, the data is just one small part of it, right? Now, first of all, we have to have clinicians, data scientists, all the right people at the table to, first of all, design the models and make sense of it in a way that makes sense with good clinical medicine, but then thinking about how do we make it actionable for providers? How do we engage payers? How are we working with nurses, mid-level providers? It's oftentimes the physician's kind of that last point of care. So we think about, and I, as a VP of product, I think a lot about that workflow of how it all comes together in terms of making sure that the workflow is thinking about all of those steps, where things get lost, and how we can make sure that at the end of the day, all of the work we've done actually gets used.
Yeah, exactly, because it's hard work, right? Building any business is not easy. And innovation, we have so many regulations, layer of people that need to get involved, approved. So it's really crucial to say, what does that entire journey looks like? Who's all have the hands in this process? And making sure that we feel good about the impact that can be created. And it seems to be easy getting to the point of what the result can be. And I think sometimes it's also about like making it so simple that people can talk about it so much easier, right? Also because genetic testing, I think people understand the importance of it, but the application can be so wide. And then from the lineage testing when 23andMe started to now people can do genetic testing to match the dose of medication, right? And then supplements. What are you actually missing? You're not just putting everything in your body and don't really know what's the marker for that, right? So all of this. So Is there anything specific you guys are focusing on, any specific disease process or any application in terms of we see that more of a direct to consumer or is more of a clinician led in smaller practice versus a system wide?
Yeah, let me walk you through an example in oncology. So again, it's impossible for physicians and providers to keep up with all of the guidelines, all of the evidence. We're working right now in non-small cell lung cancer, which is one of the few tumor types where there's an approved liquid biopsy that helps actually pick which treatment is going to be effective. It matches the mutation to the drug. But again, it's also new. Physicians are treating many different tumor types. We see that only 18% of patients are actually having this test ordered, even though it's in the guidelines. And then when they actually get the results, only 44% of patients are actually on the drug that was recommended. So not only from a financial, but also a clinical standpoint, that's just a huge opportunity to help them out. So here's what we're doing. We're working with the payers, and we're also trying to ease that prior authorization process so that there's that administrative burden, that headache that I think is part of why physicians aren't ordering the tests or aren't following the care pathways we know they should. We're trying to make that as easy as possible. And so what we've found is not only by providing that decision support, but again, easing that administrative burden makes it easier for them just to do the right thing the first time. They don't have to second guess it. And then we're able to bring the time from taking the test to getting the drug from 60 days down to 15. So I think it's a nice kind of tangible way that it brings it together, again, like with all of the right stakeholders at the table, including the payers, and really helping patients get the best possible care.
Yeah, it's all about like everything we're looking at is like faster to treatment, right? Or can we prevent something from progressing to the end stage? So for you guys, it's really shorten that gap of delaying treatment because that's the standard is the standard, and then we didn't have any option until now. And it's the exciting thing to go after the payers because they're already being identified and triggering with the disease coding and then things. So we actually can help narrow down the group. So how many payer groups have you guys already been engaged with?
So we're working with over 30 payers. We actually are not contracted for 90 million lives, so 1 in 4. So yeah, we're working with a very broad swath of the US. And lab spending it's overlooked. It's less than 5% of overall spend, but it has outsized influence. We know that 70% of clinical decisions take into account some type of testing, and we know that 50% of visits incorporate some type of a lab. And so even though it's a small part of spend, it affects so many downstream things. And so making sure that, again, all the players at the table have the information that they need in the right form, in a way it's actionable, is really powerful.
Yeah, as you guys start seeing into next year, right? We're going to the last quarter and going to the next year. What's the bigger picture for next year that you're hoping to achieve?
Oh gosh, I'm going to be overly optimistic as I am, but it's been a rough year for payers, right? Healthcare expenditures have, exceeded, I think, even what most people were expecting, and everyone's looking for, ways to save money now. Fortunately, we have one of our solutions does that and it really helps to make sure that payers are only spending money on the most evidence-based, clinically backed tests, and we can help them save money tomorrow. But my hope is that we start thinking even longer term. So while we're doing that, how we can start making sure that we've diagnosed our chronic disease patients who maybe aren't getting the care that they need? How can we use analytics to make sure that our precious GLP-1 dollar that we're spending is going to the patients who need it the most? We see that in our data that unfortunately among diabetics, the healthier patients are 3 times more likely to get a GLP-1 prescription, and among obese patients, the healthier ones are 14 times more likely to get a GLP-1 prescription. So I really hope that we start looking at a longer term view and finding ways that we can really get that preventive care in the hands of patients and providers sooner.
Right, it's all about like finding the right people instead of just thinking, oh, this sounds good, this is good, let me just grab a prescription and start testing it, right? And then when those are really not evidence-based, even though they think it is part of their treatment plan. And sometimes because some of these things are too readily available and not regulated enough, and that's why we see that skew of, oh, everyone's on it, right? And like everyone somehow just able to get it, but not having that holistic view of how medicine should be, right? Taking into all the consideration of their family, their genetics, and their other comorbidities before making those decisions. So we're excited for you guys to be on this journey. I also always love to ask a fun question. If we give you a magic wand, the magic wand grants you 3 wishes to help speed up the goal for the next year. How would you use the magic wand?
Oh gosh, I just wish we were all incentivized for like, just rather than like a 2-year horizon, maybe a 5-year horizon. Would that be okay? Can we just, optimize for patients' health in 5 years? It's so hard, right? Because we know these diseases take so long to progress. So I think that would be my way. How can we incentivize ourselves to take care of patients on, longer term? And I'm just gonna have one wish.
Now you gotta come out
I don't want to get greedy.
Yeah, I think that's a principle of like the old school doc way of someone who take care of you, your family, from pediatric all the way to senior years. And then now we're seeing so fractionalized. Even you go to the same practice, you might be seeing multiple different providers. So people feel like, oh, you have no idea what happened to me last time. You're barely reading my chart. There's no patient-provider relationship anymore, right? So and there's a friction that we have built to create lack of trust in the pathway. And then you also have the multiple layer of people just can't get care, right? Yeah. Certain diseases, certain specialties, it's just not available, right? Yeah. And then people are locking into certain state. They can't, even there is available outside state, and then they have a high premium. So the more that we can figure out from the payer side, from allowing the public understand the options, and then not just say that more option is a good option, right? Then it's analysis paralysis, and also connected what you meant by the nurses, the care providers, all the way to the patients and caregivers.
And specialists too. The number of times I've spoken to, a nephrologist and a PCP, and they're like, well, who's responsible for their diabetes? I thought it was you.
Exactly. And people start bouncing, right?
And it's different in different markets.
Correct. And I think there's never going to be a right question. It's always how can we have an open enough dialogue and closed loop communication, and not just chart it, oh, there's my plan, hoping someone will just pick it up, right? Mm-hmm. How can we get back into that, oh, I can actually message, call, or a different automated way to actually trigger the care plan so things are actually following up. We have CRM system, we have all these tools. Let's do it better, right? Like, it's not like back in the day that you bumping into a clinician on the hallway, be like, hey, let me psych consult you, and before you go see that person, right? And we have all these tools. So I think the more interoperability start coming into play, the more people like you guys that are actively, especially identifying these subgroups, will have more solutions. And it's exciting to be in this space right now. We have a lot of hope. Now it's just like, okay, there's a lot of ideas. Who are the strategists to help us plan it? Who are the next level of people who actually implement it? Yeah. And then who are the true champions to help us talk more about these things so we can get them educated to all of it in the proper way, right?
I think that's so true. We have fancy tools, but at the end of the day, it's people thinking about patients, working with one another, trying to solve problems. And that's the hardest part. The technology is actually easy.
So as you guys are expanding, are you hoping to continue to expand into the payer market, more on the lung cancer detection, say, or you guys are starting to already going down other pathways?
So like I said, we work with a lot of health plans. Right. What we found is that it's interesting. Medicare Advantage has actually gotten a lot further in terms of value-based care than I think the commercial and self-funded market. And so now we're starting to work a little bit more with employers, brokers to help out the self-funded space, because a lot of times, because they've taken on that additional risk, their provider ecosystem in terms of their TPAs, in terms of all of the different building blocks that they're bringing together to make that health plan, they're so fragmented that it's actually a lot harder to do a lot of that value-based care. So it's an interesting opportunity, and I think employers are actually the ones who are incentivized for a longer term wellness of their employees. I'm really excited about that.
Yeah, and I actually recently met someone who specializes in tax reduction for the employers, so they can have the money to use for health plans and incentivize. And I'm like, wow, more people should know about it, because one of the questions is going to be like, how do we squeeze in? We understand retention is valuable, keeping your employee happy, right? Healthy is good, but where is that allocation of fund coming from? So I think that more people can merge together for these resources, then we can really do something a lot bigger and then in all different facets of support. So I thank you so much for being here chatting. It's exciting for everything that you guys have already built, and then can't wait to have more follow through to see how you guys are planning out next year. How can people best to continue these conversations with you?
So I'd love for people to read our lab trend report. That gives all the nuggets and information and insights that you need to know to get smarter on labs and diagnostics, where the different costs are in terms of site of care, what's growing, what's not. So Avalon Healthcare Solutions, our lab trend report is a great place to learn more.
Perfect. So for anybody else who's watching, who's listening, if you're already in the diagnostic space, we would love to hear what are some things that you guys have built to speed up the path to being identified. Because at the end of the day, the faster we can get to a result, the faster we can catch up for the next phase of treatment and the options that can be discussed. And for anybody who really wanted to look into those data, go to Avalon and start reading those reports and reach out to Dr. Schultz and to have those open dialogue. Many of us are very active on LinkedIn, so we can't wait to see what you guys are already been doing out there, so the more collaboration can be happening.
Awesome.
Thank you for listening. Remember, the positive change we're seeking starts right here with me and you. If you are a fan of the show, or if you are just having struggles or success that you're either experienced in the past or are experiencing now in the healthcare industry, these matter to all of us. I want to hear from you. Visit 𝐒𝑠abrinarumback.com/connect and send me a direct message. Talk soon!